If you want whole body health, a great place to start is your mouth. That's because oral health may be linked to heart health. And our next guest wonders if she could be at risk.
My name is Mahogany. I found out I have early gum disease. My mom in her 20s had gum disease and she lost some of her teeth. And honestly, I don't want the same to happen to me. I'm starting a career in real estate. I interact with new people all the time. And I need a great smile to be successful. I'm also married, and together we have 4 sons. So I want to know how we can all keep our teeth and gums healthy.
Mahogany is joining us today, and here to help her out is registered dental hygienist and Crest spokesperson Debora Carrier. Debora, welcome back to the show.
Thanks, Dr. Orton. I'm happy to be here.
Pleasure to have you. Okay, Mahogany, I'm told that gum disease is not the only thing you're concerned about. Is that right?
Yes, that's correct, Dr. Orton. My maternal grandmother passed away of heart failure. And honestly, I'm wondering if the same thing can happen to me.
It's very important. You should talk to your healthcare provider about your medical condition and the family history you just shared. And also mention if you smoke, as smoking is a risk factor for heart disease and also increases your risk for gum disease. Visiting your dentist for a checkup every 6 months is important because people with advanced gum disease are 2 times more at risk for a heart attack. And Debora, what tips do you have for Mahogany?
Well, first of all, she should know that there's over 6 billion bacteria that live in our mouth. Some are good and some aren't. So when it comes to our gums, keeping bacteria in check is so important.
It sure is. You know, if left untreated, these bacteria can cause serious gum issues like periodontitis. Plus, studies have linked periodontitis to heart disease, so it's clear good oral health is an important part of whole body health. Mahogany, any questions?
Well, yes, I do for Debora. How do you know if you have too much bacteria in your mouth?
So if your teeth don't feel as smooth as they do after a dental cleaning, that's probably the presence of bacteria.
Good point. All right, Debora, let's move on to tip number 2, which is reduce plaque. Plaque can cause gingivitis, also known as early gum disease. What happens? Your gums turn red, are tender, and are more likely to bleed. And Mahogany, you mentioned that you're experiencing this as well. So Debora, what else should Mahogany know about plaque?
Plaque can also result in periodontitis, which is advanced gum disease. This can affect the gum and the bone that holds your teeth in place and may result in tooth loss, which is what Mahogany said happened to her mother.
You know, to keep plaque at bay, we know that flossing and brushing your teeth twice a day is important, but also it's important to gently brush your gums as well. Mahogany, I was told that you sometimes skip flossing. Is that true?
Who told you that, Dr. Orton? Yes, it's true. And honestly, sometimes we forget to brush our teeth before going to bed.
So Debora, I'm sure you probably hear that from other dental patients as well.
I do. So it's very important to brush at least twice a day. And using the right toothpaste to help promote gum health is very important when you do brush.
And to make sure you're flossing properly, once the floss is between 2 teeth, move it in a C shape along the side of one tooth, then do the same along the side of the other tooth. And finally, moving on to our last tip, Debora, you just alluded to this. You have to use the right products. Replace your toothbrush every 3 or 4 months because if the bristles are frayed, they're not going to clean your teeth properly. Also, replace your toothbrush after a case of a cold or the flu. These small adjustments can make a huge difference. All right, Debora, what would you recommend for Mahogany?
So I think she would benefit by neutralizing the harmful bacteria at her gum line. For healthier gums, I recommend Crest Advanced Gum Restore Deep Clean. It's clinically proven and can help heal gums in 7 days by treating gingivitis. And it's available at Walgreens and Walgreens.com. But Mahogany, I would like to get you started with a 1-year supply.
Oh, thanks, Debora. I really appreciate that.
Lucky you. Mahogany, thank you so much for sharing your story.
Thanks for having me. I really appreciate it.
All right, best of luck. And Deborah, always nice having you here at the doctor's.
Thank you, Dr. Orton. I had a blast.
All right.